Hi, my name is Olivia Quimby. I'm a student nurse at the University of South Alabama, and today I'll be doing the NG tube insertion checkoff. Now you'll scan the room. Okay, so first I will perform hand hygiene, and then I'm going to take my order, and I'm going to verify my order with the hospital policy. I'm going to also identify the patient by using two identifiers. So I have the patient's wristbands right here, and my order form, so Jaguar Jones, date of birth, August 25th, 1963, August 25th, 1963. Mr. Jones has an allergy to penicillin, and he has a penicillin wristband. So now I'm going to explain the procedure to the patient. I'm going to provide privacy, and then I'm going to gather all materials I will need for the procedure. So I'm going to need my stethoscope. I'm just going to slip this in my pocket, and then my pen light, and then this will act as our tongue blade for the procedure. So now I need to put on my goggles, don my goggles, and now I'm going to perform hand hygiene. I'm going to raise the bed to a working height, lower the side rails, and make sure the patient is positioned comfortably. I'm going to put on the pulse oximeter on the patient's index finger, and I'm going to assess their vital signs. So I'm assessing for vital signs. I'm going to auscultate the bowel sounds, and I'm also going to use the pulse oximeter to look at the oxygen saturation. If there is a decrease in oxygen saturation or there is deterioration of vital signs, I will stop the procedure and I will not continue until the stability of the patient is determined. So now I'm going to raise the head of the bed to high Fowler's position, and I'm going to explain to the patient that we're going to create a cueing sign to stop the procedure to stop me during the procedure. So a sign such as holding your finger up. So now I'm going to open the Salem Sump packaging, and I'm going to take the lubricant and I'm going to put it on the packaging, set this to the side, and now I'm going to take my tape. I'm creating 4 pieces of tape, one for the NG measurement, one for temporarily putting it on the patient's cheek, another for doing the final fixation, and one more for labeling on top of the nose. So I'm going to create dog ear piece of tape to mark the measurement. I'm going to discard this piece of tape and restart. And then for this last piece of tape for the final fixation, I'm going to use my scissors and I'm going to cut equally on both sides. And then I'm going to curl the ends so it looks like this. I'm going to place this side up. Now I'm going to use my 60 milliliter syringe, and I'm going to pump it to make sure it is working properly. And now I'm going to don my gloves. After donning my gloves, I'm going to check the patency of the patient's nares. So I'm going to plug each nair and ask the patient to breathe normally. And same for the other side. And now I'm going to use my alcohol swab, and I would either use alcohol swab or soap and water, and I would clean the top part of my patient's nose. So now I'm going to take my NG tube and I'm going to measure it on my patient. And so I would never measure this over the patient's clothes. I would normally ask them to remove their top or expose their chest. And so I'm going to measure it from the ear to the nose and then nose to the xiphoid process. So I'm going to measure from the ear to the nose. And then now you can look at me, sit up straight, from the nose to the xiphoid process. All right, so this is right at 50. And so now I will apply my dog ear tape right at the marking. So now that I've properly got my NG tube labeled for placement, I'm going to take my towel and I'm going to put it over the patient's chest. And I'm going to take my basin and put it over the patient's abdomen, and this will hold the NG tube during insertion. So now I'm going to uncoil and make sure that it is not too stiff for insertion. And then I'm going to take the tip of my NG tube and I'm going to put it in the lubricant, and I'm going to lubricate 4 inches of the tip of the tube. So now I'm going to put my tubing into the basin, and I'm going to tell my patient that I'm about to insert. I'm going to ask my patient to put their head all the way back against their pillow, and I'm going to insert pointing downward into the nair. I'm going to insert all the way until the nasopharynx. Once I reach the nasopharynx, I'm going to ask them to put their head down towards their chest and relax, and then I'm going to insert 1 to 2 inches and rotate 180 degrees. While I do this, I'm going to instruct that the patient will swallow with water or dry swallow. So I would instruct them to swallow, 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 all the way until it is to the tape indicator. Swallow and then swallow. So now that it is to the tape, if the patient were to cough or experience a decrease in oxygen saturation or have respiratory distress during this, I would stop the procedure and I would retract the NG tube all the way to the posterior nasopharynx. And I would not begin until the patient had normal respiratory rate. And then I would begin by instructing the patient to swallow, and then I would insert, twist 1 to 2 inches again, like I just stated. So now that we're in the correct placement, I'm going to loosely apply the NG tube to the patient's cheek. I'm going to take one of my pieces of tape and I'm going to put it on the patient's cheek. And now I'm going to check to make sure that I'm in the appropriate placement of the NG tube. So I'm going to use my pen light and my tongue blade. I would ask the patient to open their mouth, and I would look inside the patient's mouth, hold down their tongue, and look for the NG tube. Also, I will check to make sure we are in the correct place by using my 60 milliliter syringe. I am going to put it into the Salem sump port. This is again to make sure we are in the correct placement of the NG tube. I'm going to aspirate gastric contents, and then I will also check the pH if indicated, and I can use an x-ray if ordered, if needed, to make sure we are in the correct placement. So now I'm going to clean by using Skin Prep, and I'm going to clean the top of the patient's nose, and I'm going to now remove the dog ear tape. I'm going to discard. I am now going to place the final fixation tape on the patient between the patient's nose and the NG tube, making sure it's loose and it's not uncomfortable for the patient, but still in the same spot. I'm also going to put the label over the patient's nose, and I'm going to take a non-removable marker, and I'm going to mark the exit site on the tube. This is a guide for tube displacement, so this would indicate that. So now I'm going to ask my patient to move their head left and right. As hospital policy indicates, this is to make sure that the tube is not too slight, that there's enough slack for the patient to move around. So I'm also going to remove the temporary cheek tie, and I would discard of this. And then now I would do the left and right to make sure once more that the patient is comfortable with how it is set up right now. So now I'm going to demonstrate how I would do suctioning. I'm going to remove the syringe, and I'm going to have a straw to stimulate my suctioning. I'm going to place this plastic tubing on the pump, and I would insert the suctioning tubing into the Salem sump, and I would turn on the suctioning to intermittent suctioning. If suctioning were not indicated, I would take my blue pigtail and I would loop it around and connect it in a loop. This is for just if we do not need suctioning. I would normally have this above the level of the stomach, and I would place it on top of the patient's bed. And now I'm going to lower the patient's bed to 30 degrees. I'm going to lower the patient's bed all the way to the lowest setting and raise the side rails. I'm gonna make sure the call light is near the patient and that the patient is comfortable. So now I do not need any more of these items, so I'm gonna move them to the side. I would typically discard, clean up, and move on. So I'm gonna remove my gloves and discard. Now I'm going to perform hand hygiene, and I'm going to document. So I'm documenting the type, the size, the time, the location, whether the left or right nair. I am also documenting how I secured it and how I verified the placement of the tubing. I'm documenting if suctioning was used or not. I'm documenting the patient's tolerance of the procedure, the amount, the color, and the characteristics of the secretion. So now I'm going to show how I would discontinue the NG tube. So first I'm going to I'm going to verify to make sure I'm doing this correctly, verify with hospital policy, and then I'm going to take my towel and I'm going to place it over the patient's chest. And now I'm going to perform hand hygiene, and I'm going to explain the procedure to the patient, and I'm going to don gloves. Okay, so now I'm going to use my stethoscope again and auscultate the bowel sounds on the patient. I'm going to turn off the suctioning, and I'm going to remove the tape from the patient. Remove, and I will discard. And now I'm going to explain to the patient that he or she needs to breathe slow and deep breaths, but breathe and then hold while I am removing the tube. So I'm going to clamp the tube, and I'm going to smoothly and steadily remove the tubing. Okay, I'm gonna put all of this up in this towel, and I'm gonna discard. I'm going to measure the drainage, and I'm going to provide oral care, and then I'm going to document. And this concludes this assessment. Thank you.